So I'll be talking about two different models. The first model I'm going to talk about is the eye foreign body removal model, and this is a model that I made out of the ballistics gel, which again, you can apply it to many uses. The main idea here is to get a sense of how to actually use the ballistic gel. So to make an eye foreign body removal model, kind of the primary supplies that you might have to go out and buy would be the ballistic gel itself, some kind of picture of a pupil, and if you go to Wikipedia, Wikipedia has like a Creative Commons license iris that you can just put literally like hundreds on a single sheet and go to FedEx and get a nice high resolution printout of it and cut it off, cut each of the individual irises off, and then some kind of hemispheric mold, as they've already alluded to. This mold here, you can get a tray of 12 off Amazon for very inexpensive, and then you can either cut them up or keep it as a tray and make multiple models at once. Other supplies that you'd have either at home or your sim center would be just a stove, a pan, something to put the iris into the hot gel so you don't actually have to touch the gel, and then when everything's done, some kind of foreign body, whatever foreign body you want to add into it. So to start, the overall procedure is pretty simple. We melt the gel, pour a little bit of the gel into the model, just enough to make kind of an anterior chamber, put the iris face down into the hemispheric mold, pour the rest of the gel on top of that iris, wait for it to cool, and then put our foreign bodies on it. As Ian already alluded to, the gel really does smoke. In a big room like this, it's not terribly obnoxious, but as someone who once put it in my oven to heat it up to 250 degrees, it destroyed my house for about 3 hours. And it was the middle of winter, and yeah, all the windows open in the middle of winter is not ideal. It starts gelatinous, and then you can literally just put it on a hot plate or on your stove on low heat, and then over time it slowly starts to melt. You can see it melting there without any significant smoke, but kind of as it all gets heated, it does start to smoke a little bit. You can see it's not completely melted, but yet there's a little bit of smoke. The smoke is part of this process, so you just have to embrace it. It doesn't mean that it's burning up or anything else terrible. I've been to the factory where they do all this, and they literally have ovens of this going, and it's just a smoky mess with like garage doors open everywhere, letting free air in. A word of caution, anytime you use the ballistic gel, I mean, part of its benefit is that it is ultrasoundable, and it looks transparent if you want a clear model. The trouble is, if you stir fast, you're going to get bubbles. And even in its melted form, it's not perfectly liquid, it's still somewhat viscous, so those bubbles tend to stay in there a while. So if you stir really aggressively, you're going to get a lot of bubbles in there. So I'm impatient. I clearly stirred too aggressively here, and then there were a bunch of bubbles, which you'll see that outcome of that when I show a picture of the eye model. So we've melted it, we have these bubbles, which is not ideal. I should have like paused, remelted, waited for those bubbles to dissipate. But you can see I'm pouring a little bit into the mold there, so I have just enough for like an anterior chamber of the eye. I take my iris, put it face down into the mold, pour some more gel on top of it to fill up the gelatinous mold, and then you really want to wait. It's tempting. You're going to feel the outside of it, and you're like, oh, it's cool. But as you can see here, like I'm trying to pull it out too early, so the center core is still hot and warm. The gel actually retains heat pretty well, so I would just give it extra time. Something like this probably only needs like 20 minutes to cool, but if you're impatient, it'll start to remold as you pull it out. Then, lastly, you can place foreign bodies on the top like pepper is nice and easy. It's pinpoint, but it's dark, and so it requires some dexterity to pull it out. You can see the outcome of all the bubbles here, tons of bubbles. So If we talk about troubleshooting bubbles, you can just wait and kind of tincture of time. Eventually the bubbles will go away. Additionally, if you're impatient and you pour it and it has all these bubbles, a heat gun actually does a good bit to remove at least the surface bubbles. So you can see the iris a lot better here. This is the same exact model. This is like 3 seconds of a heat gun. It just applies heat to that top layer. All the top bubbles dissipate, but the posterior bubbles are still visible. Any questions about ballistics gel or the eye model? We can talk about it at the station too. One thing to note, like at this actual company where they make all this stuff, they use vacuum tubing to like pull out all the bubbles. So if they're making like a model that they want to sell, they literally put it in a vacuum chamber, suck out all the bubbles, so it's like pristine. And that's why they deliver nicer products than we can make at home. But if you have a vacuum chamber available, you could pull out all those bubbles immediately.
Yeah, I wonder if you can do it with like wall suction in the sim center if you have one. It'd be fun to try.
Yeah.
If you do it, let us know.
The next model I'm going to talk about is a cucumber priapism model, and this is like a great example of a low fidelity model that actually replicates the procedure pretty well. It clearly does not look like priapism, but it kind of does, right? It's still an erect structure, and so the benefit of this is they learn the physical mechanics of priapism, drainage, and irrigation, and you can kind of talk over the awkwardness that would be occurring in real life. Because I feel like managing the room with priapism drainage is half the battle. When the priapism is, you're irrigating and the nurse is there and you're there and the patient's there and things are going up and down and up and down. It's very awkward, and so talking that through as you're doing this kind of I think helps prepare residents or your trainees, whoever they may be, for the emotional humor component of this actual procedure. Not to mention getting over the fact that you just put the needle in and fluid comes out. So most of these we would have at home. Cucumber is the primary disposable item, although you could throw out the rubber band and bag each time too. A little bit of food coloring can add coloring to the water, but you could just use pure water as well. You take, to start, you take your cucumber, depending on its size, you could just cut it in half or you could cut off one of the ends. This is one time that the super cheap, like 50-cent Walmart cucumbers are probably better than the organic English individually wrapped ones. That tough outer layer of skin actually lets you core out the center of the cucumber really well, and the cucumber retains its physical structure without kind of falling over. If you have an apple corer, like I know I grew up and my mom had like an apple corer, that would be ideal for this. For whatever reason, I couldn't find one at Walmart, so I just used a knife to core the inside of it out. Then you fill a bowl with water plus minus food coloring. The food coloring just adds a little lifelike component. You could make it as red as you wanted. You put the cucumber and the bag in the water. The reason you put them both in there is the cucumber, you have to get rid of all that air in the cucumber. You want the cucumber, that inner chamber, to be fully filled with water. So you put the cucumber in there with the bag and make sure the bubble within the cucumber is, bubble of air within the cucumber is out. Put the baggie around it while submerged and wrap the rubber band on it. And so that way you have a chamber within this cucumber that's filled with the liquid and a baggie on the outside with the liquid. You don't, the bag on the outside with extra liquid is really meant as kind of a reservoir so that if residents wanted to irrigate it, they could. They could aspirate it out and then push it back in without water kind of going everywhere. The one caveat to this is you could imagine if you put this on a really flat surface that cucumber could seal on that surface, and then you wouldn't be able to get the reservoir. If you just put like a small nick on the side of the cucumber, that overcomes that struggle. I just used a paper plate here to kind of cover it and make it look more, slightly less lo-fi-ish. And then literally you can just take an 18 gauge needle, put it in there, and they can aspirate fluid out and irrigate if they want. This model is kind of a single-use model because the cucumber usually is not self-sealing the way ballistic shell or other things would be. You could imagine if you want to take this model and make it slightly more complicated, you could use some synthetic skin or something and cover it, or spray paint it. You could draw a line for a urethra to add at least some visual reminder of where you might put needles. Great. Any questions about that?